My task today is to share with you some information specifically about antimicrobial drug use and resistance that we in APHIS have been collecting, and then to also talk some more about some of the recent initiatives across USDA agencies in terms of a plan to address antimicrobial resistance. And so I'm going to start off by talking about a brief overview of the National Animal Health Monitoring System, which is the home for where some of this APHIS data have been collected. Talk about some of the NAHMS studies collecting antimicrobial use and resistance data, share some examples from those studies over time, and talk to you a little bit about how our efforts and our emphasis on antimicrobial use and resistance has changed across the 20-some years that we've been in the business of collecting animal health and production information. And then I'm going to talk about ongoing USDA efforts to provide stakeholders with information on antimicrobial drug use and resistance in livestock production settings. So the National Animal Health Monitoring System is a program of USDA APHIS. It's stakeholder driven. We take that very seriously in terms of going out, polling the potential stakeholders for information to see what are the current issues that we might bring data to the table to address. Our mission is to provide information to decision makers, and we really see that as across the spectrum of decision makers, from the farm level all the way through the policy development level to those that are just interested in agricultural production and livestock production in particular. And so we try to meet a whole variety of stakeholder needs with regard to their interests in livestock production practices. Voluntary participation of the producers is a hallmark of the program. We have to engage with those producers and try to bring value to the entire community as we solicit their voluntary participation in the study. And these focus on issues of animal health, production, public health, and the environment. So we try to draw a few boundaries around what we're interested in and what we're able to work in, but it still gives us a pretty wide latitude of issues that we can address under the umbrella of the NAHMS program. We've used a variety of study designs over the years, and those of you that might be familiar with the program are probably most familiar with the cross-sectional national studies. So these are studies that solicit the participation of a random sample of producers throughout the U.S., representing the majority of that type of livestock production system. Typically, we strive for at least 70% representation of operations with commodity of interest and at least 70% of the animals in that production system. So those are sort of the floor levels of what we strive to represent. In most cases, we can go well beyond those threshold levels and represent the vast majority of production operations and animals in production in those commodities. In addition to that, we've used cross-sectional targeted studies. So these studies would be more in-depth on a particular topic area, and they're perhaps a one-time fielding of an epidemiologic study, if you will, or a survey to investigate an issue. And it's our effort really to provide more timely information on some of these critical issues. Given the nature of these cross-sectional national studies that come up on a recurring basis at intervals, generally spaced, say, 5 to 8 years apart, we recognize that some of these issues don't wait to fit into that cycle. And so this is really the avenue by which we can go at a more quick pace to bring some information that's needed. And then in addition, we have some prospective monitoring studies. So these studies are by nature ongoing and are meant to give us more real-time information about what's going on in the production systems, and are very focused studies, and they're more limited in scope or scale than these large national studies would be. Oftentimes, as a component of these, there are samples that are collected to characterize organism prevalence or attributes of organisms in the farm environment. And those are really the types and the analyses that we do with those samples is really driven by the stakeholder questions. As far as the analysis of the data, especially with the large national studies, the cross-sectional studies, the analysis of those data really allow us to infer to the population. As I mentioned earlier, we strive to represent the vast majority of animals and production facilities in those production systems, and so these estimates really allow us to infer to that larger population and make statements about either the total national population or some subsets of those based on some demographic factor, say region or size or those types of things. In addition to that, it affords us the opportunity to do some inferential analysis where we look at a variety of, say, factors or management practices on an operation and particular outcomes, whether those might be health outcomes or other outcomes of interest, to be able to characterize relationships between those management strategies and the outcomes. Well, over time, we've certainly been collecting antimicrobial use and antimicrobial resistance information across the many years that the NAHMS studies have been conducted, but I guess testimony to the fact that these are responsive to stakeholder demands or stakeholder interest and responsive to issues. I'll just give you a little bit of an indication of that by looking at one of the series, which is our look at feedlot cattle production in the U.S. In 1994, we did the first feedlot study, and there were 29 data elements directed at antimicrobial use, antimicrobial resistance in that study. In the 99 study, the emphasis on antimicrobial use was up to 109, and in the recent Feedlot 2011 study, we've got 144 elements to that segment of the study investigating antimicrobial use and related pieces. In addition, we've also increased the number of organisms evaluated for prevalence and antimicrobial resistance. And looking at those, it won't be surprising that many of those are potential food safety pathogens, but there's also some commensal organisms. So this takes a look back in time, some of the studies since 1992, where we've looked at various livestock production systems, sort of the scale and scope of those national studies, and the expansion in terms of the number of and types of organisms that we've looked at. So initially we looked at prevalence of Salmonella and E. coli 0157 in some of those populations. Gradually we started to look at more organisms, and in the 94 study was really our entree into looking at antimicrobial resistance among those organisms, and we've been there since. More recently, that portfolio of organisms is expanded to where now typically we're looking at Salmonella, Campylobacter, Enterococcus, and non-type specific or generic E. coli, and occasionally also other organisms of interest like Clostridium difficile and MRSA on some operations as well. And so that theme continues to the current studies that are in the field. The recently completed Feedlot 2011 study, the swine study, the 2012 study is the analyses are being done now, and the dairy study will be ready to go to the field early next year, collecting data on operations in 17 states. So just to maybe skate quickly through some examples of the data collected regarding antimicrobial drug use and resistance in these farm environments. I just wanted to hit upon some of these and demonstrate the types of data that are available. In no way is this meant to be an in-depth look at all of what's out there. I would invite you to our website to drill down into those areas where you may have some specific interest, and I'll share that website at the end. But I just wanted to sort of pique your interest, if I can, in terms of the types of data that are available, and also to demonstrate how some of the data collection has changed over time in response to what we've heard about needs. So for the Feedlot 99 study, the study inference was about 96% of the feedlot cattle inventory. We collected data on feed and water use of antimicrobials, injectable use of antimicrobials, selection of antimicrobials, that is, how are those decisions made, and with what input, what's the basis of the selection of antimicrobials, what training programs are in place in feedlots that address this in terms of use and selection of antimicrobials. And then we've also collected samples to characterize pathogen prevalence and resistance. So here would just be one example of the way that some of those data from 1999 were attributed. We have antimicrobial class. This is feed use of antimicrobials, feed or water use for health or production management in feedlots. And here you can see that we've separated that by size of feedlot, showing us that in fact there are some differences in the way that different subgroups of that production system operate with regard to the types of products that they might use and which classes of products would be most common in those. So that gives us some idea of what's being used out there. This also is another example of the data from the 99 study where we looked at average duration of use for those products. And I think that from this it makes some suggestion about reasons for use or how those products are being used based on the durations that you see there, very short durations for some of those products as opposed to the longer durations for some of the other drug classes. If we look at antimicrobial use in the injectable case for feedlots, don't mean to talk a lot about all of the specifics here, but I think the points in this would be that we're talking that in 99 we're talking about types of antimicrobials, so we've lumped different types of products together based on their duration of use. The long-acting products having an expected duration greater than 24 hours versus some of the conventional products. So that was one of the ways that we minimized the burden on the producers in terms of their reporting, was to try to collapse down some of those categories, and then also to continue to estimate those use categories or use levels by subtypes of the production system. So in this case by size, similar estimates available by region of the country and the like. Bottom line, about 19% of the cattle received some form of injectable antimicrobial during their stay in the feedlot, and that's attributed to various types of antimicrobials as classified in this system. You'll see that some of this has changed over time to lend more specificity to the estimates that we are able to produce. If we talk about feedlot antimicrobial use for injection, we also collected information about primary type of antimicrobials used in feedlots by injection. So rather than collect total number of doses or total number of cases treated, we asked producers to respond with primary use, in this case for respiratory disease. So you can get some indication of the levels of use, if you will, and we have some information or some ability to weight this then by size of operation. But again, these numbers and this approach will change as we go forward through time. In 2006, we did a national study of swine production. The inference population for that study was about 73% of the operations and about 94% of the pigs. Again, we collected feed and water use of antimicrobials. We collected injectable use of antimicrobials in that production system, and a variety of other data that told us about the management of antimicrobial use on those operations in terms of selection, decision making, what's being considered and who's influencing some of that. In addition, samples collected to estimate prevalence and resistance on those. This is a very busy table, but I think the point here is that that should be apparent is that there's lots of information out there that we can drill down into and look at. This represents sort of a next generation from what I showed you earlier in terms of the specificity with regard to the types of information that we're collecting. Now, in this instance, we're collecting intended reason or intended use for those products and a much greater specificity in the products that are being used. So more ability to drill down and to look at specific uses of types of products in this production system and for what reason, which then gives us some more abilities that we'll talk about a little bit later in terms of estimating overall use. Percentage of sites that gave antimicrobials or feed additives to grower-finisher pigs. So the previous was talking about nursery pigs. And so as we recognize that use practices vary by production class or age of those animals or where they're at in the production system, we've tried to break that up into meaningful categories of animals, again, to lend more specificity and to create a more granular picture of those use practices as they exist on the farm. And so this just a reminder that we're also collecting similar information to what you just saw in the grow-finish phase of swine production as well. And then in terms of approaches for some of the therapeutic uses of antimicrobials, in this case for respiratory disease, how are swine producers addressing respiratory disease? Are they treating individual animals, clinically ill animals? Are they treating by the room? Are they treating by an individual pen? So trying again to bring more information to the table and to clarify how these products are being used in the farm production environment. 2007 was our year to look at dairy operations. The inference population for the 2007 study was about 80% of the dairy operations in the U.S. and about 83% of the dairy cows. Again, some of those same uses, injectable use of antimicrobials, and some of the more specific uses for dairy production, intramammary use, and then also feed and water use of antimicrobials. Again, we had sample collection to characterize prevalence and attributes of organisms that we found on those farms. So here's another sort of next step in the specificity of information as the projects or studies evolve. And as we went into the dairy study, we actually collected more information about the morbidity rate in various classes of animals. In this case, we have pre-weaned heifers experiencing different morbidity events. The most common morbidity events that we'd see on dairy operations in this age class. And we asked about the occurrence of those morbidity events, and then of those, what percentage of the animals would be treated with an antimicrobial. So in fact, we could try to get at more specificity in terms of how those products are being used, how many animals are being exposed to those products in the dairy production system, and for what purpose. And then, in addition, specific product classes. So as we look at the classes of the antimicrobials and the patterns of use based on the morbidity event that's being treated. So again, trying to understand better how those products are being used, how many animals are being treated, and what total number of exposure there might be. In this case, looking at adult cows then being treated with antimicrobials and the types of morbidity events. So just a reminder that each age class, very different morbidity events, very different types of products being used, and a different propensity to treat those animals based on what disease is being treated. So much less common to treat some of those morbidity events with antimicrobials than others. So some decision-making being implemented there. Again, some of the breakdown in terms of classes of antimicrobials that are being used to treat those animals for each one of those types of morbidity events. So continuing that theme of trying to bring more specificity to the information that we have about characterizing use practices on the farm. Still, we'll mention some of the limitations even at this degree of specificity as we get to the end. So then, as we talk about some of the nuances of antimicrobial use in some of these production systems, so here we have use of dry cow therapy, antimicrobials in those animals, and how is that managed on the on operations, the types of products that are being used for dry cow therapy on those operations as well. So that if someone's interested in how and what total products are being used or in that farm environment, we have a little bit of data on many of those uses. In terms of in-feed use, clearly we're not seeing in-feed use on adult dairy cows, but we do see some in-feed use in the form of medicated milk replacers for some of those calves. And about a little over half of the operations were using some medicated milk replacers. That was less common in large operations than it was in small operations, and we had some information about the most common medicaments included in those medicated milk replacers. Also, antimicrobials used in heifer growing rations, a relatively small proportion of dairy operations in 2007 were using medicated growing feeds. Primarily those would be chlortetracycline inclusion in those medicated products. The Feedlot 2011 study, this is just a clip of the most recent, which is the fourth in the series of reports out of that 2011 study. And it continues that theme of a drive toward more detailed injectable use data. So once again, we're collecting morbidity occurrence, and then we're collecting treatment information based on those morbidities, and then we're collecting product classes being used for those different morbidities. More breakouts in terms of feedlot demographics, more breakouts in terms of animal demographics. So we start to talk about different placement weights of animals and talk about how antimicrobials are being used for those as well. Continue the feed and water use data with increased specificity there. Continue to collect more information about antimicrobial selection and the influencers of that, training and records, all related to antimicrobial drug use. Dr. Apley referred to this, this paper earlier today, and it represents yet another analysis endeavor that we've tried to use to augment some of the data that we have within the National Animal Health Monitoring System studies. So recognizing that we lacked some quantitative measures in those studies, by partnering with academia and the swine veterinarians, we're able to sort of develop this hybrid analysis of or augmentation of the NAHMS data with contemporary use information collected from swine practitioners to develop some sort of national quantitative use figures. And we see great value in doing this as a win-win situation where we minimize the burden of reporting on the producers and yet get more quantitative information for total use. Touching briefly on the antimicrobial resistance side, a variety of organisms that you saw earlier that we're collecting samples to evaluate, in this case showing some of the results relative to Salmonella on different types of operations, so estimating prevalence at the sample level of Salmonella and then the attributes of those Salmonella isolates with regard to serotype, and then importantly antimicrobial resistance patterns and how those differ in the different production systems and the prevalence of resistance among the Salmonella isolates, as well as a variety of other isolates, these non-type specific or generic E. coli, Campylobacter, and looking at antimicrobial resistance among the different species of Campylobacter that we're identifying on operations, the Enterococcus, differentiated by species, and the Clostridium difficile isolates as well, and additional characterizations where indicated. I mentioned species and serotype, but also in the case of Clostridium difficile, toxin genes and the like as well. Well, to segue then into the more overall USDA situation, clearly APHIS isn't the only player among the USDA agencies in the antimicrobial use and resistance arena. ARS has a long history in this, certainly participating in the NAHMS program from its inception, and a number of research projects looking at microbiology and microbial ecology throughout the production system, and looking at prevalence and also important attributes of organisms throughout that production system, including antimicrobial resistance. You heard earlier about FSIS's activities, another key player from the inception of NAHMS, and you heard earlier about the residue programs. National Institute of Food and Agriculture is a funder for extramural research, some of those research funds being substantial in size, and many people in this room being the beneficiaries of some of that funding to carry out evaluations looking at antimicrobial resistance and actually collecting antimicrobial use data as well, and also extension and outreach activities. The Economic Research Service, through its agricultural resource management surveys, has collected antimicrobial use data, and importantly has looked at economic impacts of antimicrobial use or non-use in the farm environment. National Agricultural Statistics Service conducting their agricultural chem use studies and both in livestock and in plant agriculture, where they've had some evaluations looking at antimicrobial use, say, in fruit production. So as USDA looked at engaging more deeply into this issue, we hosted a stakeholder workshop to identify gaps back in May of 2012. And we conducted that stakeholder workshop over a series of days. Initially, we involved those outside government stakeholders, including public health, consumers, producers, veterinarians, pharmaceutical industry, and others. And some of you in this room were participants in that stakeholder workshop. In the second day, we went to our federal partners, including the key agencies of FDA, CDC, and National Institute of Health. And then in the third day, we sat amongst the USDA partners and talked about needs and gaps and what we had heard in the previous components of that workshop, but also what we were thinking were important gaps as well. Not surprising, some of these themes you've already heard about both yesterday and today. There were significant gaps identified in terms of our measures of antimicrobial drug use in the production systems and specificity in terms of how those uses occur and our knowledge about resistance. And furthermore, that our knowledge about management practices and a broad variety of management practices, not just antimicrobial drug use, but how that impacts antimicrobial resistance on the farm or in the farm environment, but also downstream in the production system. There are gaps in terms of alternative medical interventions, either in terms of preventive strategies, but also in terms of treatment strategies. And education, training, and extension outreach could always use more attention as well. So USDA is in the process of crafting a plan to address that. Many of those gaps. We're attempting to prioritize actions based on the stakeholder input, leverage the resources across the agency. So importantly, not to just operate within the agency or operate in those agency silos as we have done in the past, but really to collaborate across the USDA agencies. So this plan is under development, and I think we've made some huge strides there, but I think I'm encouraged that actions are already occurring. And in the simple fact of coming together and working to build this plan, I think we've already identified a number of low-hanging fruits that we've begun to act on. And so I think that the fruits are already beginning to bear. To wrap up then, and to summarize, antimicrobials are clearly widely used in livestock and poultry operations across the U.S. I don't think there's any question in that. Use patterns vary widely by commodity and class, both in terms of the way which products are used, levels of use, and the purpose of use. And it's important that we understand those as we think about what implications that might have, both for animal health and human health. Some data are available to characterize use and resistance. I hope I've piqued your interest in terms of what might be available from our organization and some of the other USDA agencies as well. But there are limitations to the data. The discontinuous nature of the collection of the NAHMS data is problematic as we think about trying to have timely information for decision makers. We've also shown that we've lacked some of the quantitative data, which would be useful, but we're trying to address that in novel ways. It's challenging, to say the least, to understand the ecology of resistance. We've heard that repeatedly, but it's a very complex issue. But I think we're making strides in that effort, and I'm very encouraged and very hopeful that ongoing efforts by USDA and many others, not just USDA, will help fill some of those information gaps and allow us to make informed decisions in the future. And as promised, here's the link to our website for the NAHMS program at the bottom, and the contact information for us if you'd like to drill down into any more of the data that we might have available on use or resistance.